Good afternoon. This is a video on autism spectrum disorder, and it is presented by Kaya Hackett and Kristen Lees for Human Behavior and Social Environment 2. First, we're going to start out with what is autism. It's a prevalent diagnosis these days, and this can help with any misconceptions. Autism is a complex brain disorder that affects brain development. It affects many different areas, including social, verbal and nonverbal communication, intellect, motor coordination, attention span, and physical health. It is believed that the roots of autism are in very early brain development. Signs and symptoms emerge between the ages of 2 to 3 years old, but some signs can be seen earlier in an age. This would be something like a toddler not babbling and also not responding to their name. Autism is a lifelong condition and affects boys 5 times greater than it does girls. Okay, so what causes autism? There is not one cause. Research shows it's a combination between a mutation on certain genes and environmental factors. Those factors include advanced parental age at time of conception for both the mother and father, illness during pregnancy, difficult births that cause deprivation of oxygen to the baby's brain, and any other event that could occur before and during after birth that could put that infant at risk. Okay, so now we're going to move on to symptoms of autism, and we're going to start out with those social symptoms that some people may recognize. Children with autism have trouble with give and take over everyday interactions. They have a failure to respond to their name, reduced interest in people, preference to play alone, and that could be for several different reasons. One specific reason could be that children with autism get stimulated very easily. And also, they do not often partake in pretend play. So if you gave a bunch of Matchbox cars to a child that has autism, you wouldn't necessarily see them playing with the cars and crashing the cars. You may see them lining them up and then rearranging them, or you may see them grouping them by colors. And then a failure to seek comfort from parents. Next, we're going to talk about communication. As mentioned before, the delayed babbling, a complete lack of receptive or expressive language, lack of typical body language, and a potential to be completely nonverbal. Moving on to more symptoms, repetitive behaviors. Behaviors like hand flopping, rocking, jumping, twirling, arranging and rearranging objects, repeating the same words and phrases, and self-stimulating behaviors such as wiggling their fingers in front of their eyes. There are also some other medical issues that can be related because of the autism, and they include GI disorders, seizures, and sleep dysfunction. Also something called pica, which is eating items that are not food. So, such as coins, nails, and maybe perhaps paper. Okay, and treatment. Each child that has autism is unique, so the treatment for each child needs to be tailored to their specific need. Treatments can consist of behavioral therapies, medication, or a combination of both. Behavioral treatments consist of either ABA therapy, parent training, parent-driven therapies that would be supervised by a therapist, and they include the entire family. And although autism is a lifelong disorder, early intervention and treatment have shown to have great success. For instance, you could have a child with autism who is nonverbal, but through treatment has learned certain cues or has even learned how to communicate via flashcards. So they can show a picture of a meal when they're hungry, or they can show a picture of the home when they're ready to return home. This just helps the communication between the parents and the child. Okay, and now we're going to watch this short video.
Did you know that 1 in 100 people are diagnosed with autism? Autism is a lifelong developmental condition that affects the way a person communicates, interacts, and processes information. People with autism may have a learning disability, but it can also affect people of average to high intellectual ability. Some people will have more subtle difficulties, while others will have complex needs requiring more intensive support. While autism can result in a whole range of challenges, people on the autism spectrum also have potential, skills, and talents. Autism impacts on verbal and non-verbal communication. It can affect the ability to understand, process, and use language. Sam is 5. He has autism and a learning disability. Sam needs a visual communication system to express himself. It is a relief for Sam's mum that Sam can use his symbol card to tell her he wants to go home. Autism can affect the ability to form and sustain relationships and to understand the feelings and intentions of others. Lisa is 13. She has autism and attends a mainstream school.
I can't wait until the school dance. What are you wearing, Lisa?
I'm wearing my school uniform.
Lisa can get confused in conversation. She tends to think literally and needs time to process what has been said. Autism impacts on thinking, learning, and information processing. It can affect the ability to adjust to change and manage new and unfamiliar situations. Matt is 50. He was diagnosed with autism just a few years ago.
Hi Matt, it's Friday, so we're all heading off early.
I don't finish work until 5 p.m.
Matt is great at his job. It is the social expectations that are difficult. Sensory processing. Ruby is 32. She has autism and a learning disability. Ruby can get overloaded with sensory information. This can make being in the community really challenging. The headphones and sunglasses help. Around 1 in 100 people are living with autism. They are our colleagues, friends, classmates, and neighbours. Take some time to understand.
And that concludes Kristen Lee's portion of this PowerPoint.